Thank you, Madam Chair, and thank you for holding this hearing and for giving the people of Minnesota's 3rd District the opportunity to participate, 3rd District that I proudly represent. Prior to my service later, I had the privilege of caring for patients as an OBGYN for more than 20 years. And I can tell you as a physician, I am truly afraid for my patients and for my colleagues to take care of them. The Republican policies of gutting Medicaid and now threatening to not extend the ACA premium tax credits that have made it possible for millions of Americans to access health care will cause tens of millions of Americans to lose their health insurance. Such a drastic increase in uninsured Americans will have dire consequences for clinics and hospitals already struggling to stay above water. In Minnesota, we are proud to offer the kind of care that people travel from neighboring states multiple hours, and in some cases, hundreds of miles to access. It's the kind of care the community, the state, and quite frankly, the Midwest region of the United States simply cannot afford to lose. But Republicans have put the desperately needed care these facilities provide in serious danger. A salient example in Minnesota is HCMC, a safety net hospital, level 1 trauma center, and a lifeline for the upper Midwest that runs the busiest emergency room in the state of Minnesota. It trains the physicians we count on in moments of crisis, the literal future of our physician workforce. And I might add, the hospital that took care of many of the children who were shot in the Annunciation Catholic school shooting. It's safety net hospitals like HCMC that are strained even further under the circumstances Republicans have manufactured. Facilities will be forced to choose what service lines they have to cut, what workers must be let go, what patients will be forced to go elsewhere for care that will no longer be available. Failing to extend ACA premium tax credits and allowing devastating Medicaid cuts means those patients and patients of hundreds of physicians in this country will suffer because Republicans refuse to act. When a person or a family is without health insurance, it hurts their health in the short and the long term. You delay care. You postpone your appointments. You wait until you need emergency care. You give up the medications that were helping to keep your chronic condition from becoming life-threatening. Your child misses the vaccine that could have prevented a hospital stay, or worse. You miss the routine screening that could have caught the cancer early. Investments in preventative care save lives and save taxpayer dollars. Safety net hospitals and their workforces struggle when a community is made sicker by delays in care and growing numbers of people without coverage. Republicans are protecting billionaire tax cuts over the health of low and middle income families on the American taxpayers' dime and on the backs of healthcare workers across the country. And while all of that is more than enough reason to reverse that crisis, an analysis of the Republican health plan estimated over 50,000 preventable deaths as a direct result of the path Republicans have put us on. So Republicans are holding the government hostage at the expense of American lives. They've spent the last 8 months putting our vulnerable healthcare system on a fast track to disaster. They pushed almost $1 trillion in cuts to critical health programs, endangering countless clinics and hospitals, many in their own districts, to deliver tax cuts that benefit primarily billionaires. Now they're demanding we support a plan that will result in millions of Americans paying hundreds more a month for health insurance, thousands more in many cases to make the grim decision to live without coverage. Over half of the Americans at risk for the highest impact live in districts they represent. But my Republican colleagues are out of town with no urgency to act. It's unconscionable to me as a physician and should be absolutely disqualifying for the legislators failing to protect the health and well-being of the Americans they were elected to represent. With that, Madam Chair, I yield back.